Hi everyone, this is Dr. Gaurav Gupta, pediatrician, and I'm back with another episode of Your Personal Child Specialist. What am I going to talk about today? It's something that is often confused by parents. I get a panicky call or a parent who visits me saying, "Please doctor, tell me what antibiotic should I use because my child is having severe infection of the tummy. They are having green colored stools. Please tell me which antibiotic should I give." I explained to the parents that green colored stool does not mean that your child is having a severe bacterial infection. So the next question is, but then why is the stool color green? So now we come to some basic facts of how a stool is formed. All stool, when is it formed, it is green in color because it has a lot of bile in it. Now, from the stomach, when the food is passing through the intestines, this green color bile is absorbed through the intestines and it goes back to the liver, something which is called the enterohepatic circulation. I know too much of technical language here, but what I'm trying to say is normally when the stool goes through the intestines, the color changes from dark green to brown and yellow. And eventually the stool that we get is dark brown or yellow. So now the question is, why in certain babies the stool suddenly becomes green and watery and the frequency increases? Well, this suggests that there is an irritation in the gut. It does not necessarily have to be an infection. Any irritation will stimulate the intestines, so the stools will pass faster through them. This means that there is less time for all the green colored bile to be absorbed from the intestines, and hence the stools will retain the green color and they will come out as green poop. So I hope that makes sense. Green colored stool does not necessarily mean infection, and even if there is an infection, almost 80 to 90% of these infections are likely to be viral in children, which means that again antibiotics are not going to be effective. So what's the best way to treat green stool? Well, for starters, make sure that the child is not losing too much of water. Give ORS or home fluids that are like oral rehydration solution, stuff like thin soup, coconut water, like khichdi, curd, pulses, etc., rice water. All these things are quite helpful to avoid dehydration. Secondly, if you can remove the irritating substance, so if there is too much spicy food in the diet or very fatty food, then just avoid this for some time. And finally, don't be in a hurry to start antibiotic. It may actually worsen the situation. It is best to use a probiotic, which means a good bacteria, along with possibly zinc in case there is actual loose motions. And within a few days, you will find that in most children, the green stools will improve and you'll go back to the usual yellowish brown color of stools with normal consistency. So I hope this has clarified this very common question as to what to do when your child's poop is of green color. This is Dr. Gaurav Gupta, your personal child specialist, and I would love your comments. I would love that you share this podcast and the YouTube video. And if you have anything that you want me to talk about, please get back to me. Bye-bye.